My name is Christy Padron. I'm a librarian at the FAU Libraries. I'd like to welcome you to the Health Science Information Sources webinar. Before I proceed, I have a couple of housekeeping matters. You can ask your questions by text, email, or chat through our Ask a Librarian service. You can get to this at www.askalibrarian.org/FAU. Certificates of completion will be provided after finishing a brief quiz at the end of this workshop. I will provide a web address that will send you to the brief 5-item quiz. A certificate of completion will be provided after finishing the quiz with 4 out of 5 correct answers, or 80%. If you'd like, you can also open another browser window to follow or try out all the links that are demonstrated throughout this webinar. And then, of course, you can keep this one open. The session goals for today's webinar is to describe the importance of primary and scholarly sources. That is, we're going to discuss why they are emphasized while you do your assignment and your literature reviews. We'll also identify health science information sources that are available to you through the FAU libraries. And finally, I will also introduce some other sources available through non-scholarly channels like government agencies and organizations that specialize in health sciences. Now, before going into the library information sources, a discussion of scholarly publications is very important to show what it is you'll be looking for. A discussion of scholarly publications is necessary before we go into how to use the library to find them. For many of you, it's probably the first time you've interacted with scholarly or professional materials, so I wanted to give you an overview of what they are and what kind of information you can expect to get from them. To do that, I will go over some general uses of scholarly publications. Scholarly publications are often known as peer-reviewed or refereed. You will often be assigned to find articles that had undergone the peer review process or appeared in a peer-reviewed journal. Peer review is when a researcher writes about their research and they make a manuscript. They submit it to a journal. The journal then forwards it to some reviewers. The reviewers are going to be professionals within that field. They would have expertise on the topic and should be able to review it and give an informed opinion or feedback on the article's quality. Once they review the manuscript, they may accept it, they may reject it, or they may ask for revisions before they consider it for publication in a journal. If it is approved by the reviewers, it will then become published. Peer review is like a quality control process for academic and scholarly publications. Newspapers and magazines generally do not undergo that type of review before they are published. Scholarly publications focus on primary or original research. They communicate research that has been done within the health sciences as well as other academic and professional fields. Scholarly publications informs the professional community of developments and research that are being done within. There are many updates in the health sciences field in terms of information and treatments and other related aspects of healthcare and health science practice. Scholarly publications helps keep professionals updated on what is going on in terms of the knowledge and what is known about their discipline. Scholarly publications are also used to support and inform later research that is done by a researcher. Ideally, before a researcher pursues a project, they're going to take a look at the professional publications by doing what is known as a literature review. The idea is to see what has been done on a particular topic so they know what has been done. Maybe they can identify some new ideas of how to go about getting to know a topic or an area of interest. I will focus on 2 types of sources that you're going to encounter for scholarly and professional publications and give you a couple of examples. The one that you may be looking for the most are known as primary sources. Those are first-hand accounts of research. A research study has been done, and a researcher and his or her team will then write about their research and the results. Examples of primary sources will include original research articles, such as the one that you see here in this slide. Primary sources could also include theses or dissertations that had been done for an advanced degree. Lab notebooks or field notes are other examples of primary sources, and so is raw data. Interviews are considered a primary source, and so are creative works. Primary sources document a first-hand account of research that had been done. I'm going to select this article, Contraceptives as Possible Risk Factors for Postpartum Depression, to give you an example. Here's the article as it appeared in Nursing Open Journal. As you can see, journal articles are going to look much different than the usual newspaper articles or blog posts that you may read. A research article is going to focus on one area or one topic. It's going to begin with an abstract that provides information about the particular study that they are writing about. It will describe usually the research question, hypothesis, or aim. It will introduce the design or methodology that was used to do the research. It will also describe the population or the people that were studied. And then they may show results or a conclusion. The rest of the article will then provide more detail on those areas. Another aspect of a research article you will frequently see are the credentials of the authors. Here we see that the first author is affiliated with a nursing school in Japan, and it looks like the rest of their colleagues are also have affiliations with professional or academic institutions. I will go through the article briefly, but an academic article will generally begin with an introduction or a background. It will then show the methods, that is, how they researched this topic, and describe any instrumentation that they may have used to do this, like a survey or a test. Then they will show the results of the research. A lot of times they may have tables and charts to add more details, such as what we see here. And then they will end with the discussion. They will talk about some of the conclusions they found based on the research, what it may add to the body of knowledge on their topic, and they may also talk about the limitations for this particular study. And here are the limitations as I just mentioned. Sometimes you may see information about statements of conflict of interest. And then peer-reviewed scholarly journal articles will show the references or works cited that were used to inform the research. You are asked to look at primary sources of information for your assignments, so you can look directly at the research that was done and how it was carried out. Your professors want you to use direct sources of information when you do your assignments or literature reviews. Okay, I'm going to go back to the slides now. I also included interviews and creative works as a primary source because some of you may be doing qualitative research where you may be asking people directly for their opinions or their take on things as opposed to a measurement or something that needs to be quantified. Then we have secondary sources. You're probably going to be more familiar with those. These are going to be sources that discuss, study, or comment on information from primary sources. Examples include literature reviews. Sometimes an author or a group may take a look at all of the literature or journals or other publications that are available on their topic and make a summary about that. A systematic review is similar to a literature review, except it provides inclusion criteria in the review. The researchers want to specify what kind of patient population is being studied. They want to put together journal articles and research that have similar, if not identical, research designs. And they also want to make sure that the research is carried out the same way. Those are what they call inclusion criteria. For in a systematic review, articles that are included are in it because they were found to follow the inclusion criteria. Meta-analyses are another type of secondary source. They're very similar to systematic review, except they will usually pool the data and statistics from a research study. And once again, they have inclusion criteria to include articles for a meta-analysis. Opinion pieces or editorials are also another type of secondary source. Articles in trade journals are also considered secondary sources. They're not necessarily based on research. They're probably not going to be written by the researchers that carried out the study, but rather a journalist or another professional who writes about the research done by someone else or another team. And then finally, textbooks are another example of a secondary source. All these sources take information from primary sources like journal articles based on original research and theses. They summarize them, and then they make a new publication with that. Here we have an example of a systematic review called Hostile Clinician Behaviors in the Nursing Work Environment. If you have questions, you can ask a librarian by chat, text, or email at www.askalibrarian.org/FAU. Now we're going to go into finding health science information. The FAU Libraries provides access to primary and secondary sources. You can get these through its library homepage at library.fau.edu. The two sources I'll be showing you through the FAU Libraries is CINAHL, which has an emphasis on nursing but does cover other health sciences. PubMed has a medical emphasis and also covers additional disciplines within the health sciences. The FAU Libraries also has a lot of databases, which are online collections of articles and publications. We do have others in medicine, nursing, and health sciences. Keep in mind that these sources are subscription-based. You have access to them as an FAU student. However, the public does not necessarily have access from them, especially from off-campus. I will show you how to authenticate yourself when you're off-campus. This is the library homepage. When you're off-campus and you want to use these information sources, select the Off-Campus Connect, which is a key icon. You'll be asked to log on with your FAU Net ID, and once you do that successfully, you'll get this message. It will take you back to the library homepage. Now, to get to CINAHL or other library databases that we have, go to the link Databases, which is the gray tab toward the middle of the page, and then enter the database you want to find. In this case, we will search for CINAHL. It will then take us to a link to CINAHL. We'll select that, and then we can go to its search page. CINAHL works by looking for articles and information based on the keywords that you provide. Let's say you have an assignment on effective patient education practices for people with diabetes. What we do now is enter the main terms in the concept. In this case, we'll add patient education and diabetes. Then we can begin our search. We found 6,052 articles based on the keywords patient education and diabetes. Here we have a list, which is a brief record of results. For the result, using technology to provide diabetes education for rural communities, we can get more information. We have a descriptive title. Then below that, we have what is known as a bibliographic information, which is the authors, the name of the journal or publication, the year, the volume, and page numbers. We then get the abstract or the summary of the article. Below that, we have the subjects. Those are going to be the main concepts discussed in this article. To the left of that, you have a little icon of a paper. It shows that we have an academic journal. To get more information about this result, we can select the title to get to the item's full record. The full record will provide us with more information. Here we have the authors and their affiliation. We have the source, a publication type, and the language that it is published. We have the major subjects once again. We also have the abstract. The journal subsect will tell us more about the journal where this was published. In this case, it was blind peer-reviewed. It's a nursing journal, and it was published in the USA. We're also given the DOI, or the Digital Object Identifier, which will often go into the citation. If you feel that this information is relevant to your assignment or your topic, you can read the full article. Select any link that says full text. In this case, we have PDF full text. Here we have the full article as it appeared in the Online Journal of Rural Nursing and Healthcare. We can scroll down the page to read the full article. On the right-hand side, we have some tools that we could use if we want to keep the article or save it. We have the Google Drive icon. The print icon shows that we can print it. The envelope icon allows us to email it to ourselves or other people if we're working with others. This gold paper is a cite tool. It will provide citations of this article using commonly used citation styles such as American Medical Association or AMA, or from the American Psychological Association or APA and their citation styles. The results list link on the upper left corner will take us back to our list of brief records. We then can continue our search for articles. Since we found 6,000 items, there's a few ways that we can change our search. We can either use the advanced search feature when we begin our search. Here's where we can specify what kind of publications we want in our search results. If your assignment requirement has you use articles from a certain span of years, the publication date is where we can define when we want our articles to have been published. Let's say you have the requirement to use articles published in the last 5 years. We're not finished with 2019 quite yet. If we have the requirement to have a peer-reviewed article or something that had appeared in a peer-reviewed journal, we can select peer-reviewed. You may use also the research article and select that to limit it to articles on empirical research. Another common requirement is for an author to be a nurse. You can select whichever one is relevant to your assignment. And then finally, we can limit our results to be a particular publication type. If we're trying to find articles that are case studies, we can select that, and it will only pull up case studies in our results. However, journal articles are most frequently assigned. Once I made my selections in my search options, I can do my search again. I went from having over 6,000 results to 1,000. Once again, I can take a look at the brief records and the information they provide to select articles that may be most useful or relevant for my assignment. A good practice when searching for information is to try multiple searches and to use multiple keywords in your search. For instance, I could possibly use patient teaching in place of patient education. They mean pretty similar things. I can also specify a particular condition. There are many different types of diabetes. So let's say I want to emphasize childhood diabetes. That is, I want to see good patient education practices for people who are working with patients with childhood diabetes. My results changed with the focus on articles that discuss juvenile diabetes. I can clear my search and then start over again or try other searches. There's an introduction to CINAHL. Another source that we could use is PubMed. Once again, in the library database search, I will enter the name of the database, PubMed. We have two different versions of PubMed. We have Medline PubMed and then PubMed Medline. Let's select PubMed Medline. We are at the PubMed page. It provides us with a box where we can enter the search terms that describe the articles we want to find. In PubMed, I can continue my search for patient education and diabetes. Notice that I put quotation marks around patient education. When I do this, it is known as nesting, and it ensures that the words patient education will be together in my search results. This should result in more relevant articles in my search. I'll select Search to begin. Here I have a list of search results. PubMed looks a little different than CINAHL, but it does have very similar features. In my search results, I found 1,911. Below that, I have a list of brief records. Just like in CINAHL, we have a descriptive title that describes the article. We then have the bibliographic information, such as the authors, the publication where this had appeared, the date, volume, issue, and page number, along with the DOI. Once again, if I select a title, I should get to the full record. Here I have the abstract for this particular article. I can take a look at the author information by selecting the plus. Below that, I have the mesh terms. If I select the arrow next to it, it will provide me a list of words that describe the main concepts also discussed in this article. Below that is link out. It can help me go to full text sources so I could read the whole article. I'll select Taylor and Francis. PubMed took me to a landing page for this article, Readability and Suitability of Spanish Language Hypertension and Diabetes Patient Education Materials. as it appeared in the Journal of Community Health Nursing. Here we have a web page with the full article. Any link that says PDF will take me to the PDF version of this article. Once again, we have the article as it appeared in its journal. Although I don't have the tools that were available in CINAHL, such as the Google Drive and the email, if I hover my cursor toward the top of the page, I will have some tools available for me. Here I can download this particular article onto my computer. I can also print it. Since it opened another tab, I can close it and then return to the landing page and then back to my full record. I could also use the Find It at FAU full text link to get to the article. I then can go to the back button to go to my list of results. I can change my search results on the left-hand side. Here, PubMed allows me to indicate what article types I want to have. If I select Customize, it will provide me all the article types that are available here. I can say I want a clinical trial, maybe a data set, or a journal article. I'll select Journal Article and then Show. I can also change the publication dates of what I want in my results. In the custom range here, I can indicate the years that I want my publications to have been published. Once again, I'll try the last 5 years. My results change from over 1,000 items to 745. PubMed works the same way as CINAHL had with its search terms. I could try synonyms or words that mean something similar to my initial search terms that I had used. To see other databases available in the health sciences, in the library database search option, select the link Browse Databases by Title. This will take you to all of the databases available through the FAU libraries. Toward the top left side of the page, we have All Subjects. Selecting the drop-down arrow will provide us the broader categories of disciplines. If we select Medicine, Nursing, and Health Sciences databases, we will go to a list of those. On this page, we have a list of databases. Here we have the title of a database, and then underneath it is a summary of what kind of information you can find in it. Underneath the title is the area of emphasis. Access Pediatrics will focus on pediatric practice in medicine, ranging from neonatology through adolescent medicine. If I scroll down the page, I can find additional sources. Just to highlight some that we have available, we have Anatomy and Physiology online for people who need to brush up on their APA or want to study for those classes. Here we have CINAHL. The Cochrane Library is a collection of systematic reviews and meta-analyses. Systematic reviews and meta-analyses are frequently used in evidence-based practice or evidence-based medicine. The FAU Libraries also provides access to Embase, which is a very large collection of publications in medicine and also medical technology. The FAU Libraries also provides access to instrumentation. Here we have HAPI, Health and Psychosocial Instruments, which provides information on surveys and other tests used in the health and social sciences. Ovid Online is a collection of journals available through the FAU Libraries. Psych Articles and Psych Info are collections of professional journals in psychology and other related disciplines. A final source that I will show you through the FAU Libraries are the research guides. If I select the research guides link on the library homepage, it will take me to some categories. I can go to Nursing, Medicine, and Health Sciences. Then it will provide a page of library and information sources recommended for a particular discipline. In this example, I can go to Neuroscience. This research guide or LibGuide will show recommended information sources available to the library for the subject of neuroscience. It will also provide articles. Articles and indexes will take you to more specialized sources. Browse Journals will provide a list of individual journals that can be searched for articles. Find Books will get you started with finding what is available through the FAU library, whether it is print or an ebook. We also provide websites where you can get more information, especially from organizations. Next, I'm going to go into finding information through government and professional organizations. Now we're going to focus on finding health science information from other sources. The government provides a lot of health science information. Federal, state, and local agencies do a lot of research. They also have consumer health information. They may also provide data and statistics. One example is the U.S. Health and Human Services webpage. It is the larger federal agency that oversees the health and well-being of people in America. The HSS includes the National Institute of Health and also the Center for Disease Control. Let's take a look at the HSS's webpage just to get an overview of what kind of information you can find through a government site. Government web pages will often provide a lot of information. In this example, we can go to laws and regulations about health and human services here. We also have information about the grants that may be offered through HHS. We can also use the A to Z index. It will give us information about various health science topics. We have concepts such as addictions, ADHD. It also will go into agencies that provide services. The U.S. government and all of its agencies combined are one of the largest producers of researchers in the world. They do produce a lot of publications based on their studies, their hearings, and other activities that they do. The Health and Human Services homepage has an area dedicated to the research that it does. In this particular example, it has a link to research at HSS operating divisions. This page provides links to the many different research activities done by the Health and Human Services. If you're looking for statistics, it provides HRSA data and statistics if you needed that for a study. And it also provides other statistical sources that you could use based on work done by the government, its contractors, and people who had received grants through them. You're not necessarily limited to only federal agencies for health information. State and local agencies also provide a lot of research and data on health topics and people within their particular area. The Florida Department of Health has a lot of data and information about the health of the people of Florida. Here you can get information on various areas of focus by the Florida Department of Health. In this example, you can get information on programs and services that are available through the state, such as WIC, minority health, and public health campaigns. You also have some topics on children's health, both for practitioners, researchers, and the public. You've got information on licenses that are issued by the state for a variety of health services. The state of Florida does a lot of surveillance in terms of health issues with its citizens and people here. And then we have some information on diseases and conditions. Maybe you needed to provide some consumer health information that's not as technical in its language and written for a lay audience. The Florida Department of Health also takes a look at environmental health and also consumer safety. The Florida Department of Health also works in all of the counties within the state of Florida. The Florida Department of Health has a presence in Palm Beach County as well as Broward and Miami-Dade counties. If you'd like county-specific information, I would go to the web pages for those areas. Health organizations are also a source of research, data, and also consumer health information. In this case, we've got the American Cancer Society that does provide a lot of research and data, and also pamphlets and other information sources. Sometimes the consumer health pamphlets and information may be in other world languages like Spanish, Creole, or French. If you have any questions about using the library, you can ask a librarian. You can also request an individual consultation with us at tinyurl.com/consult-orient. You can meet individually with the library, either face-to-face, through Zoom, that is, virtual video conferencing, and we can also reach you by telephone or email. You can follow us on social media to keep track of current events at the FAU Library, so follow us on Facebook, Twitter, and Instagram at FAU Libraries. Our YouTube and Pinterest pages can be found by just entering FAU Libraries. Now for the quiz for Certificate of Completion. It's going to be available at tinyurl.com/FAU-LIB-quiz4. You can also review our other webinars on our YouTube page. Now for the quiz. Here we have a 5-item quiz based on the content that we covered here in this webinar. We will need your email address and your first and last name, both to send you the quiz and to put your name on the certificate. You are free to look over the webinar to help you with these answers. You can also take the quiz multiple times if you need to. Thank you for joining me today for the Health Science Information Sources webinar. If you have any questions, you can contact me. My name is Christy Padron. I'm an FAU librarian, and my email is kpadron@fau.edu. If I'm not available to help, any of my other colleagues can help you through Ask a Librarian or any of our campus library service desks. I hope this is helpful for you for your search for information, and get in touch with us if you need more help. Thank you.